Hello, my name is Nancy. I'm going to be talking about the normal red blood cell. So normally the flexible, round red blood cells move easily through blood vessels. Red blood cells carry oxygen from our lungs to all parts of our bodies in exchange for carbon dioxide found in the tissues. Then they make the return trip, taking oxygen dioxide back to our lungs to be exhaled. In sickle cells, the red blood cell is shaped like sickles or crescent moons. These rigid, sticky cells can get stuck in small blood vessels, which can slow or block blood flow and oxygen to parts of the body. The bone marrow tries to make more red blood cells to make up for the loss from the deformed blood, but can't keep up, causing anemia. The shape keeps them from moving properly through the blood, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue. It delays a child's normal growth. It causes fatigue and extreme pain. Sickle cell trait is inherited. So if a parent could be one carrier or both parents can be carriers. When a child inherits hemoglobin S from one parent and a normal hemoglobin A from the other, this is considered a heterozygous carrier state, which rarely has any clinical manifestations, meaning that the child is going to be asymptomatic. So, for example, these two children right here would be asymptomatic. So all forms of sickle cell disease are lifelong conditions. So this child actually has a disease. He has both the abnormal hemoglobins, which is hemoglobin S. This inherited disease. There aren't enough healthy red blood cells to carry oxygen throughout the body. So what is sickle cell? This is a form of autosomal recessive disorders. Sickle cell is characterized by production of hemoglobin S, sickle hemoglobin within the erythrocytes. So we're going to have the original erythrocyte, and it's going to turn into hemoglobin S. Hemoglobin S is formed as a result of a genetic mutation, which one of the amino acid is replaced by a mutated one, causing the sickle cell. Under the condition of decreased oxygen, tension, and dehydration, hemoglobin S stretches and elongates, causing an erythrocyte to assume a characteristic of sickle cell shape. These sickle cells also die prematurely, resulting in hemolytic anemia. Hemoglobin S is soluble and usually causes no problem when it is properly oxygenated. When oxygen tension decreases, the abnormal hemoglobin B chain of HbS polymerizes, forming abnormal fluid polymers. These polymers realign. They cause the red cell to form into a sickle shape. There are triggers that cause the sickling process, including decreased oxygen. So if you have decreased oxygen, it's going to cause deformation of the red blood cell. It's going to cause sickling, platelet activation, and blood cell adhesion. So decreased pH level is another trigger. Temperature changes. Living in a high altitude location can cause decreased oxygen, which adds to the sickling progress. Hypoxia leads to tissue ischemia and infraction, which is cellular death. What do sickle cells do? Sickle cell erythrocytes tend to plug the blood vessel. It increases the viscosity of the blood, which slows the circulation and causes vascular occlusion. It causes organ infraction. So the increased blood viscosity also increases the time that erythrocytes are exposed to less oxygen, which promotes further sickling. So an example of something that has high viscosity is syrup. So this fluid has high viscosity, so the ball is harder to go through the fluid to reach the bottom of this graduated cylinder. So some clinical features are obstruction of the blood vessel, which is caused by the sickle cells. vascular inflammation, and increased red blood cell destruction. So now I'm going to hand it off to my colleague.
Types of episode crisis in sickle cell. 1. Sequential crisis, which is the excessive pooling of blood primarily in the spleen and sometimes in the liver. Reduced circulating blood volume results in hypovolemia and can progress to shock. Hypovolemic shock includes irritability, tachycardia, pallor, decreased urinary output, cold extremity, trendy pulse, and hypotension. 2. Vaso-Oculative Crisis, which is also known as the painful episode. We have the acute and the chronic symptom. For the acute symptoms, it includes severe pain, usually in bones, joints, and abdomen, swollen joints, hands, feet, abdomen pain, hematuria, obstructive jaundice, and visual disturbance. For the chronic symptoms, include increased risk of respiratory infection and osteomyelitis, retinal detachment and blindness, systolic murmur, renal failure, and seizure. 4. We have the aplastic crisis, which include extreme anemia as a result of temporary decreased red blood cell production, typically triggered by an infection with a virus. 5. Hypohemolytic crisis, which is increased rate of red blood cell destruction leading to anemia and jaundice. What labs are important for sickle cell disease? Screening for sickle cell anemia in newborn is mandatory in all the 50 states in the United States. These include CBC to detect anemia, sickle turbidity screening tools detect the presence of hemoglobin S but will not differentiate the trait from the disease. Hemoglobin electrophoresis. This separates the various forms of hemoglobin and is the definitive diagnosis of sickle cell anemia. During sickle cell crisis, hemoglobin is decreased, white blood cell count is elevated, bilirubin and reticulocyte level are elevated, and the peripheral blood smear reveals sickle cell. Thank you.
Hi, I'm going to talk about medications. The goals of pharmacotherapies are to reduce and prevent the complications. The drugs used in the treatment of sickle cell disease include antimetabolite, analgesics, antibiotics, vaccines, and nutritional agents. For example, hydroxyurea is a drug that inhibits deoxynucleotide synthesis. Crizanlizumab is a P-selectin inhibitor that reduces the frequencies of vaso-occlusive crisis. Oxycodone aspirin, methadone, morphine sulfate, oxycodone Tylenol are used to control pain. Sulfadoxine, amoxicillin, penicillin, ceftriaxone, and azithromycin are used for the treatment of suspected or confirmed infections. Folic acid is a vitamin and important cofactor for enzymes used in the production of red blood cells. Glutamine, also known as enderry, is an amino acid oral powder for acute complications associated with SCD. Thank you.
For a patient with sickle cell. So it is important to assess patient respiratory status. During a sickle cell crisis, red blood cell cannot effectively deliver oxygen to tissue, resulting in poor tissue perforation. So oxygen is applied as needed to the patient to help elevate the sickling cell. Monitor patient's cardiac status. Perform 12-lead ECG, as changes in respiratory status and hypoxia may lead to arrhythmia. Monitor vital signs closely. because decreased circulating blood volume can occur, resulting in tachycardia and hypotension. Assess for and manage pain. Use patient's subjective description of pain and pain rating on a pain scale to guide the use of analgesic agent as prescribed. Apply warm compresses. Clogged vessels result in damage to the tissue and organs, which causes intense tumbling pain that may change location from one body part to another. So avoid using cold compresses, as cold compress causes further vasoconstriction and exacerbate pain and crisis. While warm compress would help to dilate the vessels to promote circulation and reduce pain and muscle tension. Assess and manage hydration. It is important to administer IV fluid or oral fluid to prevent or treat dehydration in sickle cell patients, because stress on the organ system from dehydration can exacerbate the pain of a crisis because of limited blood flow due to RBCs sticking together. In some cases, blood transfusion may be necessary to manage crisis events and to increase the perfusion of oxygen to vital organs. So with blood transfusion, be sure to monitor vital signs carefully, as well as respiratory status and breath sound of the patient. To encourage routine eye exam, because tickling of red blood cells can damage the vessels in the eyes over time and cause blindness. Assess for changes in consciousness and mental status. Decreased perfusion of oxygen to the brain tissue may result in confusion, loss of consciousness, or stroke. Lastly, educate patients about preventing infection, need for vaccination to be up to date, and hygiene, avoiding extreme weather and physical activity, mental physical stress, staying hydrated, and avoid smoking.